What I say is that let's learn about what's good for us that also tastes delicious, that we love. And by the way, many of those healthful, science-studied ingredients are the elements that are the foods found in the Mediterranean diet and the Asian diet.
This is the Visible Voices podcast. I'm your host, Dr. Resa E. Lewis. In today's conversation, I am so glad to be bringing you Dr. William W. Li. Will is an internal medicine physician. In 2010, he delivered a wildly famous TED Talk entitled, "Can We Eat to Starve Cancer?" The common denominator here for many diseases, and particularly many cancers, is abnormal angiogenesis. Angiogenesis itself is the process of new blood vessels forming from existing blood vessels. Will, welcome to the Visible Voices podcast.
Well, thank you, Resa. Thanks for inviting me.
So in today's discussion, conversation, chat, I want to get practical and help our audience have some short bursts of thought around some certain specific foods and beverages. I start every morning with black coffee. What are your thoughts on the health, the anti-angiogenic aspects of coffee?
Well, listen, coffee's a pick-me-up. We all know it has caffeine in it. I drank plenty of coffee in med school and during residency, just to kind of stay alert and awake. We know that pilots will use caffeine, and military people use caffeine to kind of stay ergogenic and focused on things, for high performance. But actually, we're missing the forest for the trees, because coffee, from the coffee bean, also has bioactives. And whatever food you want to talk about today, I'll try to pull out one of the many bioactives that are in food. So for coffee, it's called chlorogenic acid. It's anti-inflammatory. It actually turns on our brown fat to ratchet up our metabolism, to burn down harmful inflammatory visceral fat. It's also anti-angiogenic, meaning it helps our body defend itself against tumor blood vessels by cutting off extra blood vessels that might be feeding cancer. So here you have Mother Nature kind of imbuing a single substance, a single natural chemical, stuffing it into a coffee bean and making it so easy for us to access every single day. And coffee indeed has been shown to decrease the risk in association studies of dementia and certain types of cancer and other chronic illnesses that we all fear.
We know you and I are both committed to science, speaking truth, pivoting misinformation into accurate information. You have given a very cohesive, cogent explanation on how we know that soy products do not cause breast cancer.
When it comes to soy and other foods, soy and breast cancer, tomato and lectins and nightshades and eggplants and, all those, there's a whole litany of urban legends that, I love to take out Thor's hammer and bash them. And I never have a problem doing this. But let me tell you, most of these false facts that float out on the internet, and even among the medical community, I have to say, because after all, we as doctors are also just information consumers, and it's impossible for us to stay on top of everything. And because we're not trained in nutrition, for the most part, we are as vulnerable to misinformation when it comes to food as anyone else. Okay. So I think that, this is a mea culpa, I think, in terms of like what we come to the table not knowing because of our education. So let me kind of let's spell out the soy as an example. Somebody who was well-intentioned and thinking realized that human cancers, like breast cancers, can be responsive to hormones like estrogen. And in fact, human breast cancers are estrogen sensitive, as we all know. And they also, this well-intentioned individual, also heard that soy also contain plant-based substances that are called phytoestrogens. Well, phyto meaning plant, if you don't really think about it, it's got estrogens in both sides of the equation. So therefore, if human breast cancers some of them might be sensitive to estrogen, well, then women should definitely stay away from soy because it's got a estrogen as well. And this is where I like to assign the good intention of somebody who's not a scientist. So they naturally put these things together, had a bully pulpit of some sort, spread the word, and just like telephone, everything kind of, that old game that we used to play when we were kids, the more you repeat, the more embellishment actually comes to it until, even in the medical community, I remember when I was, even during residency training, I'd hear certain physicians tell women, like, is there anything I shouldn't eat? Yeah, never eat soy because it's dangerous for breast cancer. Nothing could be further from the truth. And here's the whole thing. I'm a scientist. I'm a vascular biologist. So I look at facts. Human estrogen, if you put it up on a screen, it looks like a certain chemical structure. If you put up a plant estrogen, a phytoestrogen, it looks nothing like it. Does not resemble the human estrogen at all. Now, we know the structure of the molecule has everything to do with the function of the molecule. And because the plant estrogen in soy doesn't look like the human estrogen, in fact, it doesn't trigger the hormonal response. In fact, what plant estrogens, phytoestrogens from soy specifically does is it blocks the human estrogen receptor, thereby serving really as Mother Nature's tamoxifen, because we write prescriptions for a drug to block human estrogen receptors every single day to treat breast cancers. Okay, so not only did I just tell you that the chemistry tells us that soy isn't harmful, this has been proven time and time and again in the laboratory, but I always try to say for nutrition, all right, show me the real proof in people. Does it really matter? Well, a study of more than 5,000 women, it's called the Shanghai Women's Breast Cancer Study, published in JAMA, right? So a credible journal, looked at the women at the highest risk of breast cancer. These are women who already had breast cancer, and looked at the correlation of outcome. Did they do well or not, don't do well if they ate soy, and how based on how much soy they ate. And it turns out that in this 5,000 women study who already had breast cancer, those women who ate the most soy, highest soy consumption, most phytoestrogen, had a 30% lower risk of mortality from breast cancer. And if they already had surgery or if they were in remission, the more soy they ate, the lower the chances of breast cancer recurrence, blocking the receptor, the estrogen receptor. Now, there's one additional thing, and this is where my research comes into play. You take the soy phytoestrogen, it's got a name, it's called genistein. All right. If I didn't tell you that genistein was the same thing as soy estrogen, you wouldn't have known. But we've studied genistein in the lab and found that genistein from soybeans powerfully cuts off the blood supply to tumors. So it starves cancer, breast cancer, and other cancers by cutting off the blood supply. Now you're tying together the chemistry, the biochemistry, the lab data, the in vivo, the ex vivo data with human studies. And I think this is really where we need to be, where we're setting out to go when it comes to food as medicine, especially for us in the medical community, because we are uniquely capable, trained to be able to take lots of different types of data, integrate them into a coherent story, and then convert that into a message that we would tell a patient, a family member, a colleague, and of course ourselves.
Thank you for walking us through that. And I want to pull out a nugget, which may or may not be surprising to audience members. We in medical school, in residency training, hardly ever get training, education, learning on nutrition, on food. And it is so surprising to people.
You know, that as you point out, the health care system is really a sick care system. We go to the doctor's office or the medical center or the hospital or the emergency room to get sick care. When we leave the doctor's office or discharge from the hospital or, come home from the emergency room, that's where the health care begins. It's really at our own fingertips. And you don't need to go to medical school for that. In fact, part of it is, as you pointed out, like don't do certain things that could actually set you up for disease or a worse outcome. Then there's the other side of it, which is really where I've really started to really nest and develop my career, which is what can you add to your life? You know, when it comes to nutrition, so much of the message about food is negative. It's fear, shame, guilt. Don't do this. Don't eat that. You're a bad person if you do this. You're going to look terrible if you do that. This is going to kill you. And even to this day, a lot of the messaging out there from influencers on social media is like, this ultra processed food, this and brand assassination, going to the grocery store with a camera and holding up a bag of something and showing and pointing out how bad it could be for you. I'm sort of flipped the script on that. What I say is that let's learn about what's good for us that also tastes delicious, that we love. And by the way, many of those healthful, science-studied ingredients are the elements that are the foods found in the Mediterranean diet and the Asian diet. And what I always tell people is, I challenge you to go to a Mediterranean restaurant or an Asian restaurant, open a menu and say, I can't find anything here that I would order because I don't like the taste of anything. There's always going to be something delicious on there. And that's indeed why these traditional dietary patterns, food patterns, actually are among the healthiest in the world. Now, that's not the modern Asian or modern Mediterranean diet because they get the same junk.
And I love how you focus, though, on prevention, starvation through eating healthy foods. And I am 100% on the same page about the health of foods and how they can actually contribute to being healthy. So I'm going to sprinkle in another one. your feeling about eggs.
Ah, okay. Eggs have a bad rap. All right. And I remember, my mom used to serve me eggs for breakfast when I was growing up every single day. And then some article came out in a newspaper that said that eggs are full of cholesterol and it's dangerous for you and it causes heart disease. And then the American Heart Association took off on that and it was presented at all the medical meetings. And in fact, when I was in medical school, there was still this lingering feeling that eggs were probably not the right thing for a health oriented person to be eating. Well, it turns out nothing could be further from the truth, but the God is in the details, as I say. And here's what it is: a high quality egg, that is an egg laid by a hen that is healthy, right? We know that when moms have babies and the moms aren't healthy, the babies are less likely to be healthy. Same deal as a chicken, right? If you get eggs that are coming from healthy hens, and that's a whole other conversation. What does that constitute? But I think if you look at humanely raised, pasture raised animals, you're getting there. You know that the egg yolk actually looks very different than the commercial egg. And that's because a normal, well-fed mommy hen, will eat carotenoids, will eat natural, plant-based sources of omega-3s, and the egg that's laid is filled with micronutrients. Okay, so number one, we now know that high-quality eggs versus factory-raised eggs actually have more micronutrients that are beneficial. Think carotenoids like lutein and zeaxanthin that actually can lower the risk of macular degeneration, a common cause of vision loss. They are also powerful antioxidants. We also now know, compared to the 1970s, that even though eggs do contain cholesterol, not all cholesterol is the same. Back in the 70s, everything was the same. Cholesterol was the other C word, right? Besides cancer. Ooh, got to stay away from cholesterol. Well, now we know that the type of cholesterol is what matters. So, and then finally, other interesting studies have been done now in aging populations. So there's this intense interest in longevity, which is not new, but now there's money, venture capital thrown behind longevity, and people who are billionaires doing really extreme types of things. But I can tell you that because aging research, geroscience is now really being actively pursued and funded. We now know that egg consumption is correlated with better brain health as we age and lower risk of dementia as well. So again, I think this is a little bit of the story of medicine, Resa, which is that we all make assumptions. We all quote things that we've heard, maybe from our teachers, maybe we read, maybe from our colleagues. But if you're a really, really good health professional and you have a science orientation and you want to stay on top of things, what we got to do is follow the data. It's kind of like cookie crumbs. You got to follow them to see where they lead. And sometimes the path changes from where we thought they would lead. It takes another turn into another direction. And that's also the nature of science. What we once thought isn't always true. We got to follow where the real data takes us.
Speaking of data, I'm wondering if you can share something that your foundation, your lab has recently come out with that might be surprising or was perhaps surprising to you vis-a-vis food and starving cancer.
Ah, well, okay. So my organization, the Angiogenesis Foundation, is a nonprofit, and we have lots of collaborations that we've done over 30 years. A recent study that we've done that's really amazing is finding out that oats, which are a component of skin creams, like Aveeno skin cream is made with oats, also part of breakfast, oatmeal, actually has unsung properties that we are now discovering in the lab. So,
Tell
um,
me more.
just like we talked about soy, okay, or coffee, what's in oats, right? I mean, oats is a little flat piece of dried stuff that you pour hot water or whatever in, and it kind of turns into a mush. Well, guess what? Oats have at least two bioactives that are being studied. We're looking at them. One is called Avananthramide, AVE. In fact, that's the kind of Latin name for oats itself. Aveeno sativa, and then beta glucan, the beta D glucan, which is another bioactive. Guess what? It's a soluble fiber. Now, if you were to just take a quick look on Wikipedia of Avananthramide and beta glucan, search them separately, you'd find that beta glucan is a soluble fiber that feeds the gut microbiome, which we know is very, very important, and it's anti-inflammatory as well and pro-immunity. So here is this sort of unsung benefit from oats. Now, Avananthramines, well, we've known for many years it's a powerful anti-inflammatory directly, and we know that because that's the reason that was put into skin cream. All right, that we put on babies and stuff to decrease the skin inflammation. Now, guess what? it's amazing to think that we can eat oats and get a double benefit of anti-inflammation directly from the Avananthramide and then indirectly by better gut health. Now, better gut health also helps us have better mental health and better brain health as well through the gut brain axis. And so there's this trickle down effect, this domino effect that can occur with foods. And we've been looking at this. Now, I'll tell you something that we published only recently. I can't tell you anything we've embargoed, but I'll tell you something that most people won't know about. We took the Avananthramide from pure oats and we studied it in a wound healing model. I know you're asking about cancer. I'm going to give you the other side of things for a second. Wound healing. So you can go into a lab, you can create a wound. It's a full thickness punch biopsy, and it'll heal by itself. But we found that if you actually inject Avananthramide to the corner of the wound, you can double the rate of wound healing, acute wound healing, normal wound healing. You double it up. When I was in medical school, I'm sure you were told by the surgeons as well, normal wound healing is about as fast as it can possibly go. Nope, not true. We can double it. Put the pedal to the metal and go from 30 to 60 miles an hour, number one. Number two, and this was the surprise, the healing had better blood flow, so more beneficial angiogenesis, how we got into this. Third, that the healing, when you cut out the wound and looked at it under the microscope, was scarless. Amazing. Okay. And then fourth, when you looked into the tissue under the microscope using, many of the technologies that are available as for staining, immunohistochemical staining, so on and so forth, we found that the Avananthramide from oats, the same oats that we'd eat, we got the oats from a supplier that also, you can eat the oats, actually recruits stem cells that come from the bone marrow. So again, this is, there's food as medicine for prevention, food and medicine to what you can eat to make the treatments that we prescribe work better. And then food is medicine. We've sort of taken a look at sort of the whole spectrum. And I think that that's a new frontier for food and health research, is to be able to discover new things inside the food and apply them in ways that maybe we hadn't thought about before.
I'm fully on the beauty of looking at what we are naturally given in terms of food and whole foods, whether it be oats, whether it be blueberries, whether it be grapefruits, whether it be black coffee, whether it be eggs, everything that we have talked about. Well, you started, as I did, with being quite academic, publishing in academic medical scientific journal outlets, and you still do, as do I. And you have published in the non-academic, more mainstream medium outlets, and in doing so have gotten your information, your medicine, your information, your messages to a greater number of people, a broader, wider audience. Can you speak a little bit personally into what you've seen as the positive of actually publishing in non-academic outlets?
I was lucky early on in my education. I think I want to say I was during my gap year in medical school. I took 2 gap years between my third and fourth year of medical school. Back then, it was kind of heresy to actually do that. People felt like, you're throwing away all your education. Why would you want to do that? Maybe you'll never come back. And I'm like, no, no, no. You got to trust me on this. There's more to be learned off the treadmill that I could take back on the treadmill and use that to my advantage. But on my gap year, I was introduced by a friend of mine, and this is why it's also good to, in medicine, where during training we're surrounded by like-minded people who are doing exactly the same thing. What was great about being on a gap year is I met lots of people who don't do what I do, and I get inspired by those kinds of influences. A friend of mine was interested in health broadcast journalism, and ABC had a program. It was like a whole weekend, and I registered for it really to follow my friend because I was so curious about what she was interested in. And I got swept into, the real media world of training for health. And I realized, wow, these reporters that you see on air on TV, they are given a story about a flu outbreak or something, like literally 20 minutes before they got to go on air to talk about it. It's at 4:30 in the morning. They got to go on to 6 o'clock news or whatever it was back then. And they had to prepare, do all their research and figure out how do you translate all of that into a meaningful message. I don't want to use the word soundbite, but they had to be clear, succinct, and accurate and practical as well, right? So I fell in love with that. So for me, translating things to the public became kind of a passion of mine. I did not want to write a book for the public, honestly, because I was so busy doing my work for cancer research and and I do wound healing research, and I was like up to my gills, literally, with my day job at the Angiogenesis Foundation. But a friend of mine, we were talking about this a little bit before taping. A friend of mine from grade school, I reconnected with, and I said, "What are you doing these days?" And she said, "Oh, I'm an author coach. I help first time authors get their feet on the ground and find out how to slingshot into the published author world. The proposal, the agent, the publishing deal, the process of writing, the book launch, all the things that, I mean, you, Risa, with your incredible, compelling book behind you, Micro Skills, the Atomic Habits of Life, coming from two physicians. I mean, look, I mean, she convinced me
Yeah.
that my day job stuff that was still at the time, very biomedical, biopharmaceutical, biotech based, like that did not have the same urgency as the work I was doing in food as medicine. Because if I told you that 10 grams of soy protein a day, which is the amount you'd have in a tall glass of soy milk, could lower breast cancer mortality by 30%, you hear that, you can put that to work right away. If I told you
Hmm.
that cooked tomatoes, 2 to 3 servings a week, which each serving being only half a cup of tomato sauce, could lower the risk of prostate cancer by 29%, you could take that to the bank, literally, or take that to the grocery store and back to your kitchen. And so I realized, her name is Robin Colucci. And I said, Robin, you are so right. This is something that I feel really passionate about, is giving people the skills to heal themselves is every bit as important as what I was trained, and like Risa, you were trained to do as well, which is take that 4,000 years of book knowledge that we had to memorize and regurgitate, onto the prescription pad or to the medical records or whatever. All that documentation, we do our best, but we can't do it all. But the people that we're seeing, if we can empower them to do better for themselves, that's actually the ultimate ripple effect that we can have.
Yeah. We have more agency than we realize, whether it's to write, to speak, and to make the food that we eat healthier. Well, when did you realize you had a voice? When did you start using your voice?
I think it came in different waves. I've always been the person in class, the student in class that would speak up or speak out if there was something that seemed important to me. So I was never afraid of lending my voice to the community I was in. I remember probably the first time that I felt the power of my own voice was when I was in high school. Some friends convinced me to run for the high school student council president, and I was on a stage saying the things that I believed in, and I got elected. But I would say, fast forward, when it comes to science and medicine, when I was training with Dr. Judah Folkman, Dr. Folkman was the kind of mentor that if you were on a student on a project that he was overseeing and you were doing the work, and the work was, the results were significant enough where we would present it or publish it, he would let us be the first author of a paper or the first author in an abstract. And then if we got to present it, he would actually train us to go on stage for him. He would have been a logical person. And then, here was a skinny medical student in a suit, that we were still trying to figure out how to dress the right way in front of all these professional experts talking about the research. And I realized that, what, I think maybe that was when I was in med school and doing this between my third and fourth year, my gap year, another kind of upside to the gap year I took, where I realized, wow, even as a med student, I could articulate something I was doing to experts and get them to nod their head, clap, stand up and cheer, and endorse and stimulate them to do even more work based on what I was doing. And so I think maybe those early experiences were really formative for me.
A final question I have for you, because you brought up oatmeal, wounds, and wound healing. When I
Mm.
worked in the emergency department in New York City, particularly New York City, and kitchen workers would come in having cut themselves, so a laceration of their hand, of their leg, of their arm. They often arrived with the bleeding having stopped because they put on coffee powder. Have you
Wow.
seen any or done any work on coffee as wound healing, as a bleeding control measure?
This is the first time I've heard of it, because I haven't taken care of people in New York City, restaurant workers who cut themselves, but it sounds pretty clever to me, to actually use what's at hand, a kind of resourcefulness to actually stop bleeding. I mean, obviously, ground coffee is absorbent, so it's a good way to pack a bleeding wound, or maybe not pack the wound, but kind of cover the wound to be able to absorb some of the blood. And no doubt um, the blood elements that come out into the coffee will coagulate, so you'd form your little fibrin clot, and the coffee beans, the coffee grounds become kind of like an extension of your tissue, and probably that would just tamponade the bleeding. But you're asking a question to a scientist who now you've got my gears turning in my head, wondering, well, are there any bioactives that could actually help? I mean, because obviously in the ER emergency room, you're not following up these patients to compare whether or not you get better quality healing. But food is medicine. So maybe we should be looking in coffee grounds, and maybe this New York City, hospitality service habit actually could teach us something, could be the spark of some new research that could lead to a new discovery. I love it.
The Visible Voices podcast amplifies voices in the healthcare, equity, and current trend spaces. Our team includes Dr. Giuliano DePortu and me, Dr. Resa E. Lewis. Find me at Resa E. Lewis, MD on social media, or visit thevisiblevoicespodcast.com. Find us wherever you listen to podcasts and watch our episodes on YouTube. This podcast is for education and entertainment purposes only. The views and opinions expressed by our hosts and guests are their own and do not reflect the opinions of their institutions. Information shared here should never substitute for clinical judgment or for medical advice. Together, we're making healthcare more equitable, one visible voice at a time.